I'm very thankful to Malini for having provided me this opportunity to share my life experiences, something that I have been through and my family has been through in the last 1.5 years. It's nice to know that there is something that is being started, planned in the space of mental health. A lot of us spend a lot of time trying to take care of our bodies, and very few of us have really spent any kind of time trying to understand the mind and mental health, if we may call it so. I also appreciate the fact that this channel is being called Soulful. So we're looking at the body, mind and soul triune in understanding and coping with challenging situations that are presented to us at any given point of time without any warning or knowledge whatsoever. On an average, when we talk about mental health, and research in the field of psychology shows that on an average we get about 50,000 thoughts in a day. And most of us are not even aware about the amount of thoughts that we have in our head. And all these thoughts are fighting for space, are fighting for attention. And a lack of awareness about this very simple fact, which can have a profound effect in terms of the way we lead our lives, can indeed help. Keeping that in mind, something to do with understanding the thoughts, where they are coming from, where they are headed, and on the way what kind of trouble or helpful nature they can be in is indeed helpful for the individual as well as society in general.
Now, would you also like to, you mentioned that you and your family has been through some tough situations recently. Would you like to share your perspective on either coping skills or the need for counsel in that space?
When we are thrown at emergency situations or situations which are life-threatening, a lot of times we go unprepared, or we are unprepared. We're used to a certain pattern of lifestyles that we keep following every day in our lives and take things for granted. And then suddenly something like a terminal illness is thrown at the family, not only just the family but even the person themselves. Coping mechanisms become a huge part, or play a huge part in understanding how to deal with something so drastic that has been presented to us. And this is where being aware of what your thought processes are, what your mental condition is at that point of time, without getting influenced by the various inputs that we get thrown at us from people all around us who I must confess have their best interests in mind, not something that they want to give to us as advice. So becoming aware, operating from a level of awareness and understanding what we can do in situations where somewhere in the background of the mind it says we might lose a loved one. That in itself becomes a huge motivating factor, so that we can just keep that person, whoever is going through whatever, in the best of spirits.
I'd just like to take you through my life-enriching experience from cancer. In the year 2004 February, when I was 36-year-old then, during the peak of my career, I was diagnosed for a type of blood cancer which is referred as chronic myeloid leukemia. So you can see it was chronic, means it's a slow progressing disease. At that point of time, at the time of diagnosis, when the results were given to me and my career was at its peak, it created a setback both to me and my family. My family consists of my wife and 2 daughters. My elder daughter was 9 years and younger daughter was 6 years. At the time of diagnosis, when the results were given to me, there was a setback. And when I say setback, it was in three different types. One is, what happens to my life? It's a life-threatening disease. Is it going to be short-lived? Obviously, when it's blood cancer, it has got its own type of medication which needs a huge financial support from the system. And emotionally, it creates a huge turbulence both within myself and my family, the caregivers. In this context, I would like to reciprocate the need of having a support system, because at the time of diagnosis, you got an oncologist, you got a hematologist, they tell you what is the disease, they tell you what is the protocol, they tell you how it should be dealt with, what's your going to be your treatment regime, etc., etc. It's all okay, well understood. But and the need for that I and my family was really needing was to get a kind of an emotional support, because emotionally you're very down because you have a life-threatening disease. And at that point of time, the medical system did not have a kind of a psycho-oncology support, and all I could do is to meet with my doctor and similar patients who have gone through with this kind of a disease. So here, the emotional support which I was literally longing for came through those patients who have gone through the disease, but not through a professional psycho-oncologist. And there was a huge gap, because unless you get the emotional strength to cope up with the disease, there was, we need to manage this all by ourselves. So I strongly advocate that a country like ours definitely calls to build in this gap wherein especially cancer patients, which impacts on their mental health as well as on the emotional downside, needs to have a kind of a system where there are professionals who can deal with psycho-oncology and give that emotional support at the time of a disease, which can fulfill the hope in a complete manner. So you got the treating oncologist, you got the psycho-oncologist, which blends to give the right support to the patient. And as a patient advocate, it's 10 years now. Ever since I got, I went into a bone marrow transplant, and at this point of time, I do a lot of patient advocacy programs. I do attend sessions globally, and I see in our developed countries, there is a huge, combination of an oncologist and the psycho-oncologist working together. And I have even worked on few work streams in many of those sessions with the treating doctors and with the psycho-oncologists. But in a country in India, there is a dearth of psycho-oncologists and to get the mental and emotional support system for the patients. I advocate that there is a need to get these kind of a psycho-oncologists on board to help the rising demand, as cancer is one of the biggest disease threatening our country, and the patients are in need of psycho-oncologists. Thank you.
Hello Malini, thank you for inviting me. My name is Mamata Rajesh and I'm a counselor trained from Parivartan. I have been in this field for 16 years now. Well, I think the greatest need of the day is to normalize speaking about mental health well-being and mental health issues. As a people, we don't hesitate to talk about a cold or a cough or a fever or an indigestion. But somewhere, because our identity is linked to our mental health, we hesitate to talk about our fears or our anxieties or our sadness. Whereas that is a fact that each of us carry those as well. So exactly like a person may not seek a doctor or treatment unless there is a need for treatment, unless there is some kind of dysfunctionality in the physical health of the person. Likewise, a person may not reach out to either a counselor or a psychologist or a psychiatrist, as the case may be, unless there is a significant amount of dysfunctionality in one's daily living. It helps to have access to information, awareness about what is mental health well-being, how can I take care of mental health well-being, what can I do to keep myself mentally fit. If these bits of information and awareness is out there in the public domain, it will help a lot of people to take steps towards maintaining good mental health. In exactly the same way, we have a lot of awareness out there on how we can maintain good physical health. It also helps in people being informed or having a platform where they can access simple tools like coping skills or life skills and how to build them, how to learn those. Because I think that makes a big difference in dealing with the regular challenges of everyone's life, yours and mine. So I think that is what is the real need of the day, and I'm very happy that this platform is going to be catering to that.
What are the kind of typical, shall we say, life issues which you encounter as a counselor? I mean, what are the kind of people who will need counseling or mental health interventions?
Counseling, if you look at it, is nothing but talk therapy. A place where you can reflect upon your thoughts, reflect upon your feelings, and get clarity for the same. A psychologist or a clinical psychologist would be working at a slightly more intense level, and a psychiatrist is a medical doctor, an MBBS who has studied psychiatry and who is licensed and qualified to prescribe medication. So if you look at it at a very basic level, each and every one of us have our fair share of anxiety, fear, disappointment and sadness in our lives. It's a part of the life process. We can't escape from that. When any of these become a little too much for the person to handle, that is where the equilibrium of life gets a little imbalanced. At such a time, it helps to have a neutral third person who can be objective, who can help me reflect about what is happening to me in this current situation and help me with some tools or skills to be able to cope. So this is basically what we do with our client work. Help them cope with the normal problems of normal life. It's only when it gets a little too intense that we might have to escalate it to a psychiatrist.
Considering the amount of stress that we have in day-to-day life today and the pace at which life is, I think mental health is a problem across the board with all different sets of population, whether it is related to school where you have issues related to bullying, peer pressure, academic performance. It could be related to college where you might have children who again have peer pressure and other pressures. It could be related to mental health in, for example, terrorism. It could be mental health related to families, individuals. So you need mental health addressed at a micro level as well as at a macro level. So that becomes extremely important in terms of actually having a forum where you can discuss, you can actually come out with solutions, you can have a panel of people who can actually throw some light on these issues which absolutely need to come to the forefront at this point.